is pitterphotography.com. Tech Tuesdays on the Dana Barrett Show.
It is Tech Tuesday, and we've got Will Hall hanging out with us, CEO from HIPnation. Good morning to you.
Good morning. Thanks so much for having me.
It's a pleasure. Listen, I was talking in the last segment about how easily Americans get upset about things, and obviously one of the things we are upset about is healthcare in this country. So glad to have you here to discuss a possible solution.
Thanks so much. We think it's at a tipping point finally.
Well, I hope you're right, because it's gotten pretty bad. So before we get into exactly what's going on with healthcare in the country and what HIPnation is doing about it, give me a little bit of your background.
Well, my background, interestingly, I'm a physical therapist by training, treated patients for about 10 years. I see the Advil over there that you've mentioned for getting going in the mornings before.
The huge jar of Advil, yeah.
So for about 10 years, took care of patients, and then for about the next 10 years was in operations. And so setting up clinics, building teams, getting to take care of folks across about 10 states with a national company. And I was buddies with one of the guys that started Healthcare Impact Partners, which became HIPnation, and they needed someone to make it operational. And so for about 2 years ago, jumped into that.
So talk about your experience a little bit, Will, kind of being, boots on the ground, both helping patients directly and then building, working on with lots of patients ostensibly.
Right.
I feel like sometimes when you skip the middleman in terms of understanding how people feel and you're really talking to the end user, you get a different sense of what people are frustrated with and what they're dealing with. Is that kind of...
Absolutely. It's been a great piece for me to take care of patients, be a caregiver at heart, being able to intersect with folks and help them get better, get their life back, but also see the brokenness of the system as a therapist.
Yeah.
And then being able to, just like you said, support a team of across 10 states and be able to impact many more patients to have that kind of experience and get their life back.
Will Hall hanging out with us this morning, CEO of HIPnation, right here on the Dana Barrett Show on our Tech Tuesday episode. It feels like Monday to me. But so let's talk about what's going on in healthcare now. I mean, it's gotten more and more and more expensive. The insurance options are kind of fewer and fewer depending on who you are and how you're employed, right? And I feel like a lot of people feel very disconnected from their own personal health care. So what are you guys doing to address all of this?
At the root of what we do is we remove insurance from about 90% of healthcare. And when you do that, it actually gets affordable and it gets accessible. It gets simple. When you start talking to folks about it, people equate healthcare and insurance. So it seems complex, but that at its root is what we do. We talk about you don't use your car insurance to get your oil changed. Why should you use health insurance for poison ivy or just a wellness visit to your doctor? At its root, it's pretty simple.
Right. So I think, well, I love that, and I'm glad we're talking about it, because I think, one of the things that's, you're right. I think we keep saying on this show, it's not healthcare reform, it's insurance reform.
Exactly.
It isn't really about my health. It's about how much I'm paying or not paying for insurance and what that is covering or not covering. Yeah. And so, but I understand why people feel like the only way to use or to go to a doctor is by using insurance, because I'm somebody who's been self-employed for a long time, and I've been insured and uninsured and underinsured throughout the course of my life. And when you ask a typical medical practice for a price, they can't even answer you. So, I say, well, look, I want to have this mammogram, but I don't have insurance. What will it cost me? They're like, well, we don't know.
Exactly. It's the way the system is set up. Unfortunately, for them, they don't know. We have a hard time as patients taking control of that and knowing. Physicians have a hard time knowing. That's one of the things as I've been working with our physicians for the last couple of years is understanding their frustration.
Yeah.
Because they call to try to advocate for you as a patient and say, hey, I've got a patient without insurance. They need this test. What is the cash price for it? And you can't find out. You get transferred 5 times and all those kind of things. So that's part of what we want to do is we want to partner with patients and physicians. We take out a lot of that opaqueness. And so you do know ahead of time. You'll know exactly what that price is. And it puts control back into the consumer, just like we have in every other place. You go buy a car, you know what the cost is.
Will Hall hanging out with us this morning from HIPnation. So explain to me exactly how that works. So if I want to participate, if I want to take advantage of HIPnation, what does that look like?
Well, we were started by 3 physicians, and what they knew is that about 60% of your health care is at the primary care level. You don't really need insurance at the primary care level in the vast majority of cases. So we are a membership model. You pay $100 for a month, and you join HIPnation. You choose your physician. You have 24/7 access to your physician. So now for 60% of your health care, you have 24/7 access. And those primary care docs are supported right now with about 75 specialists in North Atlanta. So again, now you have access to the specialists via your primary care physician saying, hey, Dana has these lab tests. What do you think? Do they need to see you? In many of those cases, you actually don't need to see the specialist. So we cut out, again, 20 to 50% of specialist visits. And then we find insurance products that fit with that. For that 10% chance or less that you need insurance in a year, that you're going to have a health accident and need a hospital.
Yeah. Well, that was what I was going to ask, because if I'm paying $100 a month, sounds great. Plus, obviously, I'm paying for the services, right?
Right.
But then if I also have to pay the now, exorbitant insurance fees that I'm paying through, the healthcare exchange, ugh.
So we get out of the exchange. That's one of the things. So we've partnered with groups that are not ACA compliant, so they didn't check all those boxes, which raised the prices, as you talked about earlier.
Yep.
But we still have products for an individual that gives you $1 million of coverage a year. We have products that work with small businesses where we've showed small businesses where they can save $100,000 a year in insurance premiums. And every single employee and their family members get a 24/7 concierge physician.
So let me ask you something, Will, because the first thing that bubbles up in my mind is, how do the insurance companies feel about this product?
Well, insurance companies don't like direct primary care. They've been against that for a while, but it's gaining steam. There was just a bill passed, I think it was in South Carolina this past week, that said direct primary care is not insurance. So we're not insurance. You can join us. You can go to HIPnation.com and join us with any medical history. There's no questions. We don't ask questions. Our physicians take care of you as a patient without insurance.
I mean, I'm kind of sold, not going to lie.
I love it.
We might turn this into a commercial right now.
Love it. It's awesome.
Well, because I'm one of those people that's really have a pre-existing condition. You know, I'm a cancer survivor, and I'm self-employed, so my options are really minimum right now. For I have expensive options and very minimal coverage, care. So, so talk to me about kind of where you guys are. Are you all across the country? Or are you focused here in Atlanta? Like what's
not
going
yet,
on? Okay.
but HIPnation. We're going to go nationally.
It sounds national.
We got really big plans. Absolutely. We want to change the world. So we're in North Atlanta for the moment. It's where our physicians are. So we have 5 offices in North Atlanta, starting in Sandy Springs, going north all the way to Cummings. So physicians taking care of patients. We've been taking care of patients for about 14 months now.
Okay.
Individuals and businesses. We have about those 75 specialists that we talked about, all North Atlanta at this point. But the neat thing is, folks don't have to be near your primary care. It's no longer, I need someone 2 miles away, because once you're connected to a direct primary care doc who knows you, has a relationship, and knows your history without insurance, they can do so many things over the phone. 80% of your care could be done over the phone when you have a doc who knows you personally.
Yeah, and I mean, most people don't need to go to their primary care, even if it is a little bit further. You go once or twice a year at the most.
Absolutely.
In person, yeah.
And when you go for that wellness visit, when there's not an insurance company between you and your physician, it's a vastly different experience. They're getting to know you. They're getting to know your medical history. What are your goals? That's actually how people get healthier. Is connected to a physician like that.
Listen, it harkens back to the time when the doctor had the black bag, Marcus Welby, MD. I was a little kid. I was very young, very, very young. But I remember as a little kid, our doctor coming to the house when I had chicken pox.
Absolutely.
And, chatting with my mom and checking me out and talking about calamine lotion. I mean, what doctor does that now?
Right.
Does this get us back, Will, to that kind of care?
It's very neat. Our tagline is healthcare as it should be. And as we've done open houses with our physicians, we invite folks to come in. We have people say, well, that's how it used to be.
Yeah.
I remember the physician. And I've said the same thing in some of those open houses. I'm from a small town in South Georgia. The doctor who delivered me delivered my mom. I remember him making house calls.
Yeah.
And you paid for what you got back then.
Yeah. And I think, look, at the end of the day, too, I think, a lot of people don't even remember that now. So they don't even know that that kind of care is possible. But some of us have at least seen it on TV. Remember Northern Exposure?
Exactly.
That was another one. This idea that, like, if something is bothering me, I could actually call my doctor, even if it might be minor, and say, like, hey, my elbow hurts. This is what happened. Should I be worried about this? And they can just say, no, sounds normal. Let's see. We'll look at it next time you're in. Or, that doesn't exist now.
We have the greatest stories with our patients. They send me testimonials and emails of, especially with the flu being rampant in Atlanta right now.
Yeah.
Patient after patient said, gosh, Dr. Shake or Dr. Bush, they kept me out of the hospital. They kept my husband out of the emergency room, where folks on a Saturday morning at 2 a.m, you're that sick, you don't know what to do, to be able to call your physician, have someone who knows you, cares about you, has that relationship, keep you out of the emergency room, out of the hospital with the flu.
Yeah.
It's been really fun to hear those stories.
Yeah, look, we didn't even get to the technology side of things, but obviously people are keeping in touch through all kinds of technology with their doctors now, which makes it even that much more viable.
Absolutely. We leverage technology, but the foundation of everything is the relationship with
Yeah,
the physician.
absolutely.
Without that.
I'm glad we focused on that then. Will, thank you
Absolutely.
so much for being with us. We will post a link to all things HIPnation on our show notes page at DanaBarrett.com. It is Tech Tuesday on the Dana Barrett Show. We'll be right back.